So I got a doozy for you guys today. So we're going to be reading about lobotomies. So grab a crazy get your popcorn and let's actually go. Let's get into this. So according to the AI overview, a lobotomy is a surgical procedure that involves severing connections to the brain's prefrontal lobe, often to treat severe mental illness. Key points. Procedure. Lobotomies were initially performed by drilling holes into the skull or inserting an ice pick like instrument through the eye socket to sever connections to the frontal lobe. What the fuck? Okay, let's see. Let's see what we got. Let's see what we got. Lessons to be learned from history of lobotomies. Tid Tid Scriff. I don't know what the hell. Tuesday, 24th June 2025. That's today. This article was made. When was this article made? There's no way this article was made today. That's too specific. The government's watching us. The fuck is going on? Okay. Lobotomy was initially considered a breakthrough in the treatment of mental illness, and approximately 3,000 lobotomies were carried out in Norway in the period of 1940 and 60. Today, the treatment is considered one of the greatest mistakes of modern medicine. Yeah. You think? Oh man. Gentle. So this is a poem, I think. Gentle, clever your surgeon's hands. God marks for you many golden bands. The cut so sure they serve so well. They save our souls from eternal hell. An artist's hand, a musician's too, give us beauty of color and tune so true. But yours are far the most beautiful to me. They saved my mind and set my spirit free. Lobotomy patient number 68C, 1942. The archives of James W. Watts III. Wow. So someone that that's very chilling. It's cold in here all of a sudden. What the fuck? Ooh, this is good. Okay. The history of lobotomy started at Yale within the field of the neurology, neurology, neurology. When the up and when the up and coming psychologist John Frecure Fulton 1899-1960 joined Yale's academic staff at the age of 30 in 1929. He was the institution's youngest professor. Yeah, for all, professors are usually a lot older than that, especially back in those days when you had to like actually read books instead of chat GPTing everything. Under his leadership, Yale School of Medicine built up one of the world's most prominent research laboratories, the first in the United States to conduct research of primates. Fulton was interested in the workings of the various parts of the nervous system and gradually came to focus on the frontal lobes of the brain. The chimps Lucy and Becky were among the first or among most famous primates in or to be studied. Both underwent a frontal lobotomy, i.e., removal of the frontal lobes. With wow, what the fuck? They removal, so they took them out. I thought it was just okay. Let's keep reading. Let's keep reading because I'm wow. Okay. This was shown to cause the loss of some functions and it affected their performance in tests where they had to rely on short term memory. However, that was to attract more attention where where their observed behavior changed. It seemed as if the apes no longer carried about earlier no longer cared about earlier mistakes made or felt frustration when they failed the tests they were set. In settings where the apes had previously become frustrated and aggressive, they now seemed indifferent to their own mistakes. In Fulton's own words, it was as though they had joined a happiness cult. John Fulton presented his findings to the International Neurological Congress in London in 1935. One of the delegates attending lost my place. One of the delegates attending the Congress was Portuguese neurologist Antonio Carneto de Abreu Freire Egues Monet. I butchered that. There's no way I said any of that right besides his first name. 1974 to 1955, or 1874 to 1955. Montez was a highly versatile man. I love that word, versatile. He had made ambassador to Spain during World War One, representing Portugal at the Versailles Peace Conference, and had served his country's foreign secretary. Wow, so this guy has done a lot. He had also invented cerebral and what does that say? Anagophy, anagophy, an agia. I've never seen that word before. What does that mean? Hmm. I've never heard of this phrase before. Let's see. A medical image. Oh, right, that's what I thought. Medical image technique to use the visualize the inside of blood vessels, both arteries, veins, to assess blood flow and idea. Okay, so how do you pronounce it? Pro. Whoa, the hell. Pro now.
Angiography.
Angiography. Okay. I've also another word I just murdered. Angiography, and twice been nominated for the Nobel Prize for this invention. It was, however, another discovery that was to bring him fame. Montez returned home to from Congress in London, convinced that it would be possible to transfer the knowledge from the experiments to a treatment for humans. He quickly initiated a collaborative relationship with the neurosurgeon Alameda Lima, and over the next year, 20 patients were operated. In the first series, alcohol and injection was injected directly into the white matter of the frontal lobes as a sterilizing medicine. What the hell? It's like I'm in English all over again. A process, or okay, how do you pronounce that? Slurrizing? I don't know. Medication. Montez, that's one thing about me, bro. If I don't know, I'm just gonna straight look it up. I'm not here to pretend like I know everything. There's a reason why I like reading articles, because I like to learn. Never seen those two words before ever. I've never had to use them. Now they're up here. Tremendous. Montez then swiftly developed a so-called lexitome, a long instrument. So I know what that is. That's the thing that they use, that long needle-like thing when they do that to you. Yeah, a long instrument with a steel strip for severing the connection of the frontal lobes. Montez and Lima reported no deaths or serious complications in the first series. The second series included 18 patients, all whom suffered from schizophrenia. They reported that 3 of these patients were almost cured and that 2 became much better. They concluded that the prefrontal leucotomy was simple, fail-safe operation that was useful in the treatment of some mental disorders. Fail-safe is crazy, considering you are literally like killing a part of somebody's brain. Wow. They also wrote that it was practically effective against depression and melancholy. The melancholy is just like you feel bad or you feel sad. And the procedure was named psychosurgery in 1949 after World War II, or that was the year World War II ended. Montez was no World War II ended in 45. Who cares? Who fucking cares? What am I talking about? Montez was awarded the Nobel Prize in Psychology or Medicine for his discovery of prefrontal lobotomy. Wow. So he won a Nobel Prize for this. That's unbelievable. Maybe it's so this was seen as a breakthrough back in those days, and since it's never been done before and nobody died, on top of that, nobody ever, or I'm not going to say ever, but as far as we can see, like the first and second series of lobotomies, nothing happened. Nothing extreme. No one died. No one complained. Some people, they said it saved them. And then you go back to this really creepy poem of somebody that got lobotomized by this guy. And apparently it worked out. Or so we think. Let's keep reading. Proliferation of the treatment. Montez was nominated for the Nobel Prize by the American neurologist Walter Jackson Freeman II, 1895, 1972. Freeman was one of the founders of the American Board of Psychiatry and Neurology and was the real pioneer of who made lobotomy a widely recognized psychiatric treatment. Wow, okay, so this is the guy that blew it up, I guess. Together with neurosurgeon James W. Watts, 1904 to 1994, he developed. Wow, he lived to be 90 years old. That's awesome. He developed the Freeman-Watts standard performance lobotomy method and authored the starting work of psychosurgery, the standard work of psychosurgery. Over a period of only 2 months in 1936, Freeman and Watts performed 20 lobotomies, and by 1942, they had lobotomized more than 200 patients and published the results. They reported that 63% of their patients had improved, while 24% saw no change and 14% became worse. One of the early patients treated by Freeman and Watts was John F. Kennedy's sister, Rosemary Kennedy, 1918 to 2005, who was lobotomized in 1941 at the age of 23. Wow. That is... I didn't know that. The operation was not successful. She required care for the rest of her life and could no longer walk or talk after the intervention. Oh, shit. Several patients suffered such serious complications, but Freeman was nevertheless remained convicted that lobotomy was a major medical achievement. However, he was less than pleased with the low number of patients that underwent surgery. Lobotomy required collaboration with a neurosurgeon and other personnel, and it therefore only available for large university hospitals. Freeman's vision was to make lobotomy a far more prolific treatment. According to his own account, that we today associate with lobotomy based on an idea that came to him while cutting ice for his drink with an ice pick. The technique was named trans happy Pride Month transorbital lobotomy. The object was to sever the connection between the frontal cortex or the prefrontal cortex and the thalamus by using a thin surgical instrument and orbital class to cut through the thin layer of bone above the eye socket. A small hammer was then used to drive the instrument into the brain. Figure 1. So right here. According to Freeman, operation could be performed without general anesthetic, or no surgical experience was required. Yeah, that's great. Put that on the record. Strictly speaking, it was not even necessary to use qualified doctor. He personally performed the first transorbital lobotomy on a patient in 1946. Watts was highly skeptical of his method and ended their partnership. Wow. So Watson was like, "Yeah, this guy's a nut job. I don't know what's going on here." So you mean to tell me that a medical breakthrough can be done by somebody that has literally never studied medicine at all? Right. Victims of their time, bro. Seriously, like plague doctors. I say the same shit all the time. You think they knew? You think we knew what we were doing? You know, putting masks on and then putting flowers at the tip of your mask because you meant back in those days, if you smelled something bad, that meant the plague. And the plague, they thought you can get it from smelling it. So they would just do everything they could. They would try to make it smell good. And, you know, they like plague doctors technically did nothing, like if I'm being honest. But all they really did was just look scary. And, you know, they wanted to help. They tried to help. They did their best. At least they were willing to do so. This guy is just fucking crazy. Despite a mortality rate of 14%, Freeman performed 3,439 lobotomies in the course of his life. What the fuck? Holy the fuck, bro? How do you do that? With the introduction of transorbital lobotomy came an upsurge in the uptake of his type of treatment. In 1949 alone, more than 5,000 lobotomies were performed in the United States. Freeman wore neither gloves nor mask when performing this procedure and was less than diligent when it came to the sterilization of his equipment. Ew, so he didn't even clean. It's nothing sterile, so he didn't wear a mask. So what? He like walked into the room scratching his ass and he's like, "All right, where's the young lady we're lobotomizing?" And that's one thing that maybe it talks about it later. But the people that were getting lobotomized were women. Men would be able to put their wives that were deemed hysterical or crazy in mental hospitals, and he would have a say on whether or not they lobotomized her. That's how that fucking happened. So the article may or may not say that, but I know enough about lobotomies to know that that was exactly what was going down. I mean, like shit, you know, life changing events, you know, super horrible situations, you know, when you just can't deal with the melancholy anymore. And then back in those days, they didn't have psychiatric treatment that actually mattered. And if they did, it was deemed like, you know, you were a weak person if you needed to talk to somebody about your problems, you know, type B. So all of that considered, you know, and, you know, again, you're in a date. These were back in the times where women didn't have a voice. Not really, not at all, almost. So the man made all of the decisions. When I mean all of the decisions, I mean everything. What you wore, what you ate, all that wackadoo shit. Okay, so where are we? Lobotomy was not okay. Lobotomy was not considered a cure for a particular disorder, but a means of reducing symptoms. It was initially considered a lost resort for patients who had failed to respond to other treatments, just like the diagnostic criteria could vary. The indication, indication were not clearly defended. The first patients who were operated on were diagnosed with schizophrenia, but the procedure was at times performed as a last resort for disorders that were considered psycho psychosomatic, like stomach ulcers and all. What is that? Ulcerative colitis. What does that mean? A type of inflammation or inflammatory bowel disease, IBD, that causes long-lasting inflammation and ulcers, sores in the digestive tract, or specifically the large intestine, colon, and rectum. Okay, interesting. So they would give lobotomies for that too. That's not even your. That's not your brain. Oh my god, these guys were monsters, bro. So this is an image of how a lobotomy was done, I guess. So they would put it like up here. So my question is, because what these guys are saying, or what this article just told us, was you didn't need a general aesthetic for something like this, meaning you didn't have to take a pain medication, a painkiller, be put under for something like this to happen. How the fuck is that even possible? I mean, like the pain alone, sure, whatever, but like, how would you have to be restraining people? You had to be there. You had to be restrained, because there's no way that you're going to put a long ice pick in my eye and then smack a hammer a couple of times until you split my prefrontal cortex from my brain, breaking a thin layer of bone so that you can get there, and then you pull it out. There's no way that you didn't feel like, what the this is madness. This is like something out of a scary movie. God, I'm having such a good time. Okay. Okay. Diagnosed with schizophrenia, and then the performed last resort, and the were considered time. Okay. Freeman appeared to be reporting particularly positive outcomes in his patients who nowadays perhaps would have been diagnosed with observed compulsive disorder, OCD. But lobotomy was also considered a potential therapy in uh, palliative care. Okay. Psychosurgery. Oh, so these are the guys. Freeman was personally, or was personally of the opinion that the treatment could stabilize the patient's personality and alleviate strong emotions. He saw psychosis as the result of excessive self-reflection, the thoughts that kept wiring back and forth in the brain. He envis- or envisaged, envis- I don't know, dude. Uh, that this never ending circle of painful thoughts could be stopped by the literal severing, or by literally severing the front or the forbs. Many of the patients he had operated on stopped feeling anxious and appeared more childlike. It was later reported that many also became apathetic and passive, that they lost all initiative and their ability to concentrate or produce an emotional response. Interesting how that works. It's almost like it's not supposed to happen. Hmm. Interesting how they started acting childlike when their prefrontal cortex was disrupted. Your prefrontal cortex is like your judgment, what makes you an adult, basically. Hmm. Dissidence and growing circumstances, or criticism, my bad. In the 1940s and 50s, there were strong uh, dissenting voices amongst lobotomies as a treatment. In the United States and elsewhere, the criticism was strong in the Soviet Union, where a complete ban on lobotomies was introduced in 1950 on the grounds that the treatment was inhumane. In the 1950s, psych, psychiatry saw that the introduction of neurological drugs and lobotomy was increasingly preserved as an inhuman and oppressive treatment. Look at that. So, what was known as a medical breakthrough 1 year later, because 49, they were still doing this. So, in 49, 5,000 lobotomies were done. So, in the 50s, the Soviet Union was like, yeah, what the fuck are we doing? And they banned it, deeming it that it was inhumane and an oppressive treatment. It is oppressive. You're literally you're altering somebody's way of thinking. You're altering who they are as a person. You are actually changing somebody's brain chemistry because you're killing a part of their brain, essentially. So, yeah, that is definitely oppressive. I agree with that. As early as 1946, Robert Penn Warren, 1905 to 1989, published his Pulitzer Prize winning novel All the Kings of Men, where lobotomy is portrayed as a barbaric treatment. In the Journal of the Norwegian Medical Association was also quite critical of lobotomies and referred to the treatment in 1959 as the invention or intervention that appeared to be random, indiscriminate, and lacking in neurological and neuronamical insight. So they don't recognize it as an actual practice. This is just something that some guy thought of, is kind of what that says. In the world of fiction, growing criticisms of therapy emerged as the 1950s and 60s progressed in subtly. The last summer in 1958, a playwright Tennessee Williams. Ooh, Tennessee Williams. I recognize that name. 1999 or 1911 to 1983 described a Marriott who wanted, I don't know what that says, who wanted to have her niece lobotomized to prevent her from revealing that her son was gay. When she told that a lobotomy will not necessarily stop her niece from doing so, she said, "That may be, maybe not. But after the operation, who would believe her, doctor?" In the famous work of One Flew Over the Cuckoos, that movie got remade. I need to watch it now. It's about lobotomies. I'll watch it. Fuck yeah. Um, that Hunter plays the main person in that movie. I gotta watch it. Okay, it's on the list now. Nest by Ken Casey in 1935 to 2001. Lobotomy is portrayed as a form of treatment that completely extinguishes a person's personality and free will. It is likely that the portrayals of lobotomy in fiction played an important part in changing views on the treatment in the medical and along or in the media and among the general population. So let me tell you something. It is completely appropriate for everybody to be, because everyone, it was recognized as like, okay, this has nothing to do with medicine. This is just barbarism for the sake of being barbaric. It's just because it doesn't make any sense. Like you don't have any consistent data to show that this is even helping, and the voices of the public are coming out and saying, hey, this is just like outside looking in. We're not doctors. And you mean to tell me that one of us randomly can do this to somebody else without cleaning our supplies, without taking like just necessary regular measures to ensure that everything is sterilized? You don't have to do any of that. Why are you calling this a medical procedure? It's not. You can do this in your fucking backyard. As far as I can tell, and that doesn't mean, that's even more of a reason why it's not a a medical procedure. That's insane. It's very, very scary. Okay, so we read that already. Why so widespread? In the years after World War II, serious mental illness were rife, and there was a dearth of good treatment offers. Dearth. What does that mean? A scarcity or a lack of something. Okay. Other parts of medicine had witnessed almost miraculous breakthroughs like antibiotics. And in the beginning of lobotomy was described as a similar breakthrough, particularly in the Anglo-American and Scandinavian media. The proliferation of the treatment largely appears to be have been based on Freeman's charisma and his ability to enthuse the public and the news media. A comparative analysis of the publication also shows that Watson Freeman both gave overwhelmingly positive reviews of efficiency or efficacy of the treatment while grossly under communicating its adverse effects. So they were saying that, oh, lobotomy is the next best thing while not really taking into consideration all of the awful shit that would go down right after a lobotomy happened. Interesting. So that's another thing we should pay attention to, right? So from this little piece, we know that there may or may not have been. So what I'm trying to, this is really long winded. A lot of their data that they collected with people saying that they had success and whatnot, you have to take it with a grain of salt now, because according to this piece right here, you can't trust the data that they had because they weren't truthful with it. Overwhelmingly positive reviews about the efficacy of the treatment while grossly under communicating its adverse effects. So we really don't know how effective it was. Or we do. We know that it wasn't effective, is what I wanted to say. The treatment, the provocation of the treatment largely appears to have been based on Freeman and, the treatment was introduced in 1940s and 50s despite the fact that little research had been carried out on the effects. Nevertheless, many of those who witnessed the first operation were convinced that the lobotomy reduced suffering and that some patients saw an almost miraculous effect. One of the problems in the psychiatry was lack of objective measurements and the gauge of efficacy of the treatment. And lobotomy scored well on the measures that did exist. For instance, the patient's IQ appeared to remain intact, and many patients needed fewer coercive measures and no longer acted out after treatment. This is why lobotomies now seen as barbaric was considered to be a humane breakthrough. Whether you have faith in treatment, this is crazy. Whether you have faith in treatment, there will always be a risk to conflicting interests and cloud your judgment, whether consciously or unconsciously, particularly if the results are financially significant or associated with prestige. The treatment was promoted by the high charismatic option leader who had good access to the media. Damn. So this guy just networked himself into a batshit crazy idea. Okay, bro. hey, hey, if you need a little bit of motivation, here you go. Right, you can just talk really loud and act like you're sure of yourself, and people will throw money and prestige at you. Apparently, that's the guy that made lobotomies. He was a doctor, sure, but he was a fucking quack for thinking that destroying a part of somebody's brain would be able to cure them of any sort of mental disease. That doesn't even sound like it makes sense. That sounds like you're going backwards. But because he was so charismatic and he was so sure and everybody cared about what he had to say and he presented himself in such a big magnetic way, people believed him. Unbelievable. Freeman was highly idealistic and charismatic doctor, and he had a strongly held belief in his treatment. Even after it fell into dispute, lobotomy has later been seen as one of the greatest mistakes of modern medicine, and the awarding of the Nobel Prize to Monty is described as a stain on the history of the prize. However, the story of lobotomy's journey from experimental to standard treatment was much in common with the way that medicine revolves medical revolutions develop. At the time, the success criteria tended to focus on curbed aggressive behaviors and and facilitating the transfer of patients from the assembly or from the asylums to the community. Interesting. I didn't know that. Okay. Heroes and villains of medicine. Whether a medical treatment is necessary and worth the risk will be a judgment call or will be a judgment call that is colored by the historic context. It is easy to blame patients in lobotomies on poor judgment shown by the doctors of the time or doctors of the past. It is, however, important to remember that those who promoted the method were driven by the idealism and the strongly held belief that their treatment alleviated suffering. One of the reasons why Freeman's report of efficacy and adverse effects today come across as highly anecdotal and unscientific is the very notion that the Constitution valid scientific reporting has changed. Today, perception of lobotomy as an outlandish and barbaric treatment is an indication that the world has changed dramatically since the 1950s. Very true. Very, very, very true. Holy shit. As doctors and researchers, we are only, not only competent or this is like it's like I'm eating something and I'm getting full. So that's what's happening. I'm like slowing down. Um Competent but also lucky or unlucky. Who will be remembered as the hero and the villain in medical innovation will depend on society's narrative about a treatment. Freeman remained convicted as all his life by the positive effect of the lobotomy, and he gave up trying to convince the world around him about his usefulness. As the 1960s progressed, he turned up a psychiatric conference with a shoebox full of Christmas cards sent to him grateful lobotomy patients and their loved ones, and he emptied them out in front of skeptical colleagues, but no one was listening to him anymore. Damn. That's deep. Past and future. When all standard treatments have failed, doctors will always have to decide whether it is time to make one last ditch attempt by trying a novel treatment at the risk of being damned if they do and damned if they don't. What is considered effective treatment will be influenced by the time we live in and how the effects are evaluated. In 1941, Clarence Clark's Burlingame, 1885 to 1950, who was the lead psychiatrist at the time, held a famous talk which he asked, "Do we use this treatment or these treatments as empirical empirically as our predecessors or empirically as our predecessors, or did their leeches and their bleedings? What? I you like trolled there. Hold on. How do you say that?
Empirically.
Empirically, yeah, that's what I thought. Empirically, as our predecessors did their leeches and their bleedings. Right. Okay, I had to reread that. Are we, in the light of others who come after us, going to be accused of being users of stupid, bizarre, and crude methods? Will they think will they think us know better than quacks? If we were to learn a lesson from history, it should be this. It is easy to blame the treatments of earlier times on poor judgment, but we are no less able to discourage ourselves from society and the framework conditions that guided our work today. The history of lobotomy should be a lesson in humanity. We can never be entirely sure what will be remembered by future generations as a breakthrough and what will be considered a big mistake. That was a great article. Down to the very last drop. Man. So, lobotomies. Horrible fucking idea in retrospect, but the article does say, given where they were in the 1940s and the 50s, when people were suffering with psychiatric things and they didn't have anything, they didn't know what to do, and this guy figures out this this way to kind of alleviate some people's pain, and it works, right? You go along for the ride, and then later on they do more research and they take a look at everything, and it's like, yeah, hey, you know what, this doesn't add up all that well. Sticking a ice pick in somebody's eye and severing their prefrontal cortex from the rest of their brain, and there's a good chance that you're making them into a vegetable. Yeah, that's kind of fucked up. It happens. Articles are they're just a good article, bro. I don't know, man. It's just so damn good. I appreciate you guys for listening. Don't forget to bring an umbrella. I'll see you guys next time. So close to the end. Can we still breathe?